Hello class, this is Dr. Branch. I'm going to talk about what is an abortion. In order to make a moral evaluation of a particular choice, a particular act, we need to describe that act, and so that's what we're going to do here, is describe abortion to help us make a moral evaluation of it later on. So there are basically two big categories of abortion. First are spontaneous abortions. These are basically miscarriages which sadly occur naturally in life, somewhat commonly. But that's not our discussion today. What we're really talking about are induced abortions. There are basically three subcategories underneath induced abortions. The first are therapeutic abortions, which are performed to save the mother's life. In the case of an ectopic pregnancy, when the baby implants in the wrong place, usually the fallopian tube, the baby will not come to term. The baby will not live. The pregnancy will rupture at some point, and the mother will bleed profusely and possibly die. I know of no Southern Baptist ethicist who says it is sin or it is wrong to have an abortion in the case of an ectopic pregnancy, because the baby will not live. So these are tragic instances that happen in life. They're also very, very low. They're very small number of abortions that are performed in the United States are for ectopic pregnancies compared to the overall total. The vast majority of abortions in the United States are either eugenic or elective. Eugenic meaning good birth. These are abortions that are performed because of some perceived defect in the baby. For example, in the United States, the majority of children who are diagnosed with Down syndrome in utero are aborted. And that means the parents don't want a Down syndrome baby. That should be a possessive right there. But Down syndrome children are aborted. So the idea is there's something wrong with the baby, we don't like it, for whatever reason, we're going to abort the baby for eugenic reasons. But then the majority are elective abortions. These are abortions that are performed because the baby gets in the way with life, either career or job or education, or I'm too young or I'm too old, or whatever the case may be. Simply elective because the baby gets in the way. Those are the majority of abortions in the United States. Now when it comes to methods, the two big categories of methods are first pharmaceutical and then surgical. Pharmaceutical or medical abortions, when we think about these, we basically have in mind RU486. What I would tell you is that to call RU486 a morning after pill is a misnomer, because you'll see it's actually a three-step process. First, the woman visits an abortion provider and she takes the RU486. At a second visit, she takes another drug which causes her to expel the dead baby, or to expel the baby. The third visit, a follow-up exam is done to make sure the abortion is complete. So it's not just simply take the pill and forget about it. To call it a morning after pill is a misnomer. It is gaining in popularity in the United States because it's less expensive. So there's a move in the data in the United States as of right now, 2015, where a greater percentage of the abortions are medical as opposed to surgical. Now when we talk about surgical abortions, there's lots of overlap in the terminology, and what I'm about to show you, some of the abortion procedures are less frequently used today, some are considered antiquated, out of date, but still done rarely. If you read the data, especially on the web, there's all sorts of overlap in these terms, and I'll try to clarify that for you as best as I can. But basically 7 types of surgical abortions I'm going to review with you. These are violent procedures that you're about to see. First is menstrual aspiration, also known as manual aspiration. It's 1 to 3 weeks after a missed period, and this is basically a suction abortion using a manual device, and I'll show one to you in just a second. It's gaining in popularity because nurses and midwives or nurse practitioners can be taught how to do this early on in the pregnancy, and so it would be less expensive. This is basically what the procedure looks like. The surgical device is placed inside the woman, and a manual, as you consider it's manual, is used to suck the baby out. This is what one of those devices would look like. These are somewhat popular in some third world countries, and so here in the States they're thinking that if they let midwives and nurses and nurse practitioners do this type of abortion, it would save the money of having to pay a physician to do it, so the insurance companies are interested in it. When we think about abortion in our country, usually what people have in mind is suction curettage or a vacuum curettage or a vacuum abortion. Suction abortion goes by many names. It's the most common type of abortion. About 80% of first trimester abortions. I'll show you some data that the numbers go up and down year after year. but you'll see some of the data later. The developing baby is removed by a suction device that's much more powerful than the home vacuum cleaner, which is inserted into the uterus, and basically the baby is sucked out of the uterus and into a jar. It's done up to, I say 12 weeks of pregnancy here, actually about 14 weeks of pregnancy according to some claims. And it's also frequently in the United States used in conjunction with a curette. You'll see that here on the diagram. This the suction device is placed into the uterus. The tiny baby is sucked out of the uterus and into a jar. And then at the end of the procedure, a curette is placed into the uterus to make sure there are no remaining parts. Sometimes the suction device is placed back in for one more pass. So the baby is sucked into pieces into a jar. And just to give you an idea, this is what a baby would look like at 12 weeks. You see the hands, the feet, the head, the eyes, the ears. Dilation and curettage. This is an obsolete method according to the World Health Organization. It was more popular. It was done even in the beginning of the late 19th century, so before the suction curettage came on. For whatever reason, it's still used in rare cases. Apparently more commonly outside the United States, though rarely. But basically, a curette is used to scrape the baby to pieces out of the uterus. And you get the idea here. The curette's placed in and just scrapes the baby out, sometimes cutting it into pieces as it does so. So sometimes you will hear a suction abortion called a D&C. I'd also remind all you preachers that a D&C is also used for other non-abortive purposes, rather commonly for ladies. So it is not uncommon for a lady in your church to say she's had a D&C for some gynecological reason not related to an abortion. Don't assume just because a lady had a D&C that it means she had an abortion, but it can be a method of abortion. Dilation and extraction is the name for a suction curettage when performed after 12 to 14 weeks of pregnancy. Again, I say 12 weeks on the slide here. Some say 14 weeks. These numbers are not quite definite in the literature you read. And it's the most common procedure for ending a pregnancy between 14 and 21 weeks. It's similar to a suction abortion but with larger instruments. So here's an idea. You'll see here he's not using suction, but this would be called a D&E. So the abortionist has placed his or her device into the uterus to clamp the baby and rip it out piece by piece and limb by limb. And again, here you get another picture. This is, again, sometimes they'll use suction with it. I'm showing you here using clamps and forceps and these sort of things to rip the baby apart, but they're all called D&E. So it's much like a suction abortion, but using bigger instruments, and the baby is basically torn to pieces and ripped out of the uterus. Saline ejection is very rare in the United States today. It was more common in the past, but it's quite rare today. It was more popular around the world. It's still used for whatever reason on rare occasions here in the States. And so this data here, where I say it's the most common method for second trimester abortions, is apparently not so anymore. So this slide's a bit old and out of date, but it's quite rare today apparently. But what happens is a needle is inserted into the water bag surrounding the baby, some fluid is removed, and then replaced by a concentrated salt solution. The baby is burned and poisoned to death. Actually, the baby will inhale the solution, so it's quite wretched. This gives you an idea of how it works. I've seen other slides where they suggest that the solution is injected through the cervix. This one shows it being done transabdominally, but the idea is that the baby is burned to death. The challenge is some people actually survive. Gianna Jessen is an example. Her mother had a saline injection abortion when she was 7.5 months pregnant with Gianna, but she is alive today. She survived the abortion. She has cerebral palsy, and she's a valiant person. Hysterotomy, I'll just say, of all the methods of abortion, to me, this is the most ghastly, because some of these children actually are born alive, and sometimes they're just left to die. Gianna was fortunate and blessed in that she was allowed to live, but sometimes they'll just leave the baby to die. Hysterotomy is the same thing as a C-section, but instead the surgeon removes the baby to kill it. Then partial birth abortion, this method also known as a DNX or dilation and extraction, is performed in the second or third trimester. The baby is delivered feet first. The abortionist will actually turn the baby breech inside the woman, deliver it feet first, and then when the head gets to the end of the vaginal canal, the abortionist will place scissors into the skull of the baby and then suck out the baby's brain and kill it. This is technically illegal in the United States today. However, if you listen to the Planned Parenthood doctor, Dr. Nucatola, and the video that was released in July 2015, as she's discussing dismembering babies, at one point it's very clear that she's describing what we know as partial birth abortion. The dead child is removed and then discarded. So this is what that looks like. Baby removed. And then here's the violent act. The forceps, the scissors placed into the base of the skull, and the baby is killed, and a dead baby is delivered. So what I want to point out to you is these are all very violent acts. When young people or adults talk about abortion, they talk about it as if it's nothing. But let's be clear what's happening when a child is aborted. These are violent acts. Children sucked into a jar, children ripped to shreds, children having forceps placed in the back of their head, burned to death. So this is a violent act. Who feels pain? Well, the mother does feel pain. There's complications associated with abortion, and there's a lot of debate about a lot of these complications. But what I'm going to tell you is, if you'll read my notes, I give you a lot of detailed information about debates and whether or not abortion is associated with things such as cervical cancer or breast cancer, all these other things. Read my notes. What we know is a baby is killed, and we know that women do in fact have nausea and bleeding. There is a higher rate of both ectopic pregnancies and miscarriages with women who have abortions. So we want to say that there's a lot of bad that comes along with it. There's also depression or other long-term emotional, psychological damage that comes with abortion. While it is common to read about the struggles of post-abortive women, it's also true that many men carry deep emotional, psychological, and spiritual scars from their participation in abortion. But to be plain, the person who feels the most pain is the baby. It's beyond a reasonable doubt that the unborn can feel pain as possibly as early as 8 weeks, and definitely by 13 and a half weeks. So all the neurological structures necessary for pain sensation are there early on. These requisite neurological structures begin developing at 8 weeks and are completely functioning by 13 and a half weeks, which gives you an idea. Many of the babies who are aborted can feel pain. They have the ability to feel pain. I put this slide here just because it's so absurd. This lady with "My baby is pro-choice" painted on her pregnant belly. It makes no sense, but it shows the absurdity of a pro-abortion crowd. The complete thing makes no sense. So here's some of the health risks: infection, incomplete abortion, which can lead to infection, cervical injury, the uterus can be perforated, heavy bleeding, retained clots in the uterus, allergic reactions, and then here's the debated items about infertility and breast cancer. I tell you, what I would say is that some of my pro-life advocates are more adamant about breast cancer and than I feel comfortable saying. What I would say is just alert people that this is a debated point. Say what we know, that we know it's debated. We're not certain. There does seem to be a greater correlation with infertility and abortion and preterm birth. So I feel more confident about those two and less confident about this one. But these are debated items about which people argue. How many abortions in the United States? Well, what we guess is somewhere around 50 to 55 million since 1973. That's as of 2015. The number of abortions per year peaked in 1990 and has dropped by 2005. There's some question about that, and the degree to which RU46 abortions are being tracked as closely as surgical abortions. So we don't. Some of this we just don't know. The number of abortions it's massive. It's, again, 50 to 55 million. Here's some of your CDC data about abortions, and I've just picked these years at random just to show you, give you some idea of some of the trends. Outside of the United States and Europe, about 30% of pregnancies end in abortion. Who's getting an abortion? Cohabitation, people who live together outside of marriage. It's closely correlated to a higher abortion rate. Minorities are vastly overrepresented. In 2008, African American women had the highest rate of abortion at 40.2 per 1,000, followed by Hispanic women at 28.7 per 1,000. But this is perhaps the most striking. In 2010, New York City had 83,750 abortions. Of those where we knew the ethnicity, 82% were African American or Hispanic. Minorities in the United States are vastly overrepresented in the abortion data. Poor women have a higher abortion rate. As of 2008, 18% of U.S. women obtaining abortions are teenagers. Those aged 15 to 17, that's 6% of all abortions. In 2008, women in their 20s account for more than half of all abortions. So you see that there. You see the data. The number of abortion providers has been declining, but what you probably know is Planned Parenthood is the #1 abortion provider in the United States. 324,000 abortions in 2008. About 89% of induced abortions in the United States occur in the first trimester. In 2009, the median charge for a surgical abortion at 10 weeks was $470. At 20 weeks, $1,500. A pharmaceutical abortion, you see the charge was around $490, but apparently these numbers are coming down. Again, the idea is it's going to become less expensive. Gestational age, 65 to 66% were performed at 8 weeks of gestation or earlier. About 92% performed at 13 weeks, so the vast majority are done in the first trimester. Of the abortions, about 73%, 72.4% were performed prior to or equal to 13 weeks of gestation where they use suction curettage. That's the most common form. What about Planned Parenthood? Let me just say a few words. Its history is founded by Margaret Sanger, one of my least favorite people in the history of America. She is the originator of the term birth control. She favored eugenics. She thought the wrong type of people were having too many babies. And she founded the American Birth Control League in 1921, which eventually changed its name to Planned Parenthood. I'm told she didn't really like the name Planned Parenthood, but she's the founder. It has its origins in her. Here's what she said in 1920, quote, "The most merciful thing a large family does to one of its infant members is to kill it." That's the founder of Planned Parenthood. It's an organization that really kind of has like franchises, if that helps you understand its organization. And there's 85 different affiliates around the U.S., and they operate 820 offices around the nation. So it's sort of like a massive organization with franchises. Taxpayer funding. It's the largest abortion provider in the U.S. Began getting federal money in 1970, and in 2014, their fiscal year, which ended in June, they received, by their own data, $528 million in federal funds. That's my taxpayer dollars and your taxpayer dollars, ladies and gentlemen, right there to them. So you see they're the largest number of abortions, 327,000. What you've heard about recently is a group performed a sting operation and got their chief of medical services on video at a lunch discussing whether or not she's selling abortion parts. Now, if you watch the whole video, she does indicate it sometimes that the issue is not really so much to make money as to cover their costs for shipping, but at the end of the day, she's talking about selling abortion parts. But what I find most offensive about the video, she's selling parts of humans, but what I find most offensive is she's eating this nice lunch and drinking red wine and dispassionately discussing the dismemberment of tiny humans with great detail. She goes into great detail about how you grab the forceps in a particular way to get a particular body part and rip it apart so you don't get damage certain organs. This is someone with a seared conscience. Frankly, she reminds me of some of the interviews I've read with Nazi doctors after World War II who just described quite dispassionately and with great animation the way they experimented on different people they had in captivity, most notably the Jews. Here's a quote from the video. She said, "We've been very good at getting heart, lung, liver because we know that's so. I'm not going to crush that part. We know that, so I'm not going to crush that part. I'm going to basically crush below. I'm going to crush below, above, and I'm going to see if I can get it all intact." And she says all this while sipping red wine and eating lunch. This is someone with a seared conscience. Well, that is a basic survey of what an abortion is. It is a violent act, and so we're going to discuss through the rest of the semester how we should respond and what should be the Christian moral stance to this particular act.